What's up, guys? A few years ago, I made a video called The Most Common Cause of Lateral Knee Pain, and I showed you a simple and effective way to try and treat this at home using just a lacrosse ball. The video has really helped a lot of people, and there's a lot of comments on it, and I wanted to go over some of the questions that I've seen in the comments and clarify them so that we can understand what this move is for and what it's not for. Let's go through some of these questions, and I'll do my best to keep it concise to help you if you're having questions about it. I'm going to be doing more of these types of videos. So if you have questions about any other parts of your body where you're experiencing pain, or you have questions about training or rehab, send me an email. I'm going to leave my email in the notes below. Send me an email, short and concise, with your question, and I'm going to start doing video responses to these questions. So let's go back to our topic, the most common cause of lateral knee pain, which in this case, I was referring to when the fibular head becomes locked or stuck in position, and this can cause pain that runs up the leg, runs down the leg, and it feels like your knee is kind of locking. And the good news about this is, generally speaking, it's not because there's damage in the knee joint. One important thing to know about the knee and remember is that the knee oftentimes is manifesting what is happening at the hip and or the ankle foot complex. It's just this hinge joint that's locked in between these two more mobile joints. And so when dysfunction is occurring either below or above, the knee is kind of like the middle child that gets sort of stuck in the middle of the argument between hip and foot. So remember that a lot of knee stuff is just a manifestation of what's going on elsewhere. So in the case of the fibular head becoming out of place, oftentimes it's because the hip is lacking mobility, and through repetitive strain, the IT band gets tight, or the biceps femoris of the hamstring becomes tight. That creates a posterior pull on the fibular head. And so that is why the anterior adjustment is so effective using the lacrosse ball. Let's go to our first question here. Lone Wolf says, what about on the inside of the knee? When I try to go full bend / sit on my ankles, it's like something behind the inside of my knee hurts when I go into full bend. When you fully flex your knee and there's pain in the back of your knee, it's a meniscus tear until proven otherwise. So in that case, this move is not going to help you. It's not going to hurt you. The good thing about this move is no matter what, unless you have a torn LCL, which is a lateral collateral ligament. And even in that case, it's probably not going to do any damage because this is such a gentle move. You're not going to do any more damage or create any damage in the knee. So this is pretty much safe for everybody, barring a major nerve injury. But when he says that he has flexion on, when he has pain in the back of the knee on full flexion, again, that's a meniscus tear until proven otherwise. So this move will not help. Next question. Says, hi, I'm a trail runner. I don't know what injury I feel now, if it is the LCL, the lateral collateral ligament, or IT band syndrome. The pain starts at the side of my knee up the side of my thigh. The pain attacks when I rest, sometimes when I sleep at night. The pain feels like a cramp in the bones. Well, as a trail runner, so we know this person is doing a lot of repetitive strain and stress. So when the pain is more active, sort of when they're at rest, it's telling me that there's a repetitive stress that's tightening the muscles and the tissues. And then when this person is at rest, as the circulation goes down, the tissues tighten. And so you're getting pain because number one, you're lying down, you're at rest, so your brain then focuses on those areas of pain. And number two, it's not getting the proper circulation because it's getting repetitively strained. So in this case, you can try this move, but more likely than not, if you're just going to continue trail running without addressing the ankle and foot mobility and also looking at the hips and the hip. So what you can do is you can go get a running exam on one of those treadmills at some of those shoe stores that do that, and they can determine how your foot is hitting the ground. You can also go see a chiropractor or a physical therapist to make sure all those joints are moving, or you can just go to YouTube and find ankle mobility drills, hip mobility drills. Start with those and see if your symptoms improve. I would also recommend foam rolling your calves, foam rolling your IT band and hamstring, and getting the muscles around the area loose. Also, sometimes it just needs a little bit of rest. So if you're doing a lot of volume, a lot of mileage, it just may be too much strain on the tissues, and giving yourself a week or two or maybe more to let it rest and you just stretch and roll it out can make the difference. Next question says, could this be the reason my biceps femoris tendon snaps every time I bend my knee past 90 degrees? My fibula seems to curve slightly on my affected leg. There's no info on the internet about what to do to fix it, and it prevents me from squatting, deadlifting, or riding a bike. Well, again, I would check uh, to answer the question, no, it's likely not just that the fibula is displaced, because the fibular head being displaced is usually a result of tissues around it. So in this case, you're saying, is the displaced fibula causing the inability of my knee to bend past 90 degrees? And most likely not. If you tried this and it didn't help your symptoms, then no, it's not the cause. Something is causing the fibular head to keep getting pulled out, or causing strain around that biceps fem tendon. So you may have an old hamstring injury that you need to roll out or get worked on, so that the tissue gets that flexibility back. That's more than likely what's going on. You may have an old an old hamstring sprain, excuse me. And there also may be something going on at the foot and ankle, and also the hip, like I said in the last response. So foot, ankle, check those. Hip, check that. And also the soft tissue of the hamstrings, make sure that there are no major adhesions in there. And you can do that at home with a rolling, or you can go see a professional and try to get that worked on. But a snapping tendon is usually because the muscle belly, or the muscle somewhere around there, it's lacking some of that extensibility due to an old injury or muscular imbalance. Okay, we got I think one or two more here, and then we'll be all done. This says, does this work for runner's knee? And the short answer is no, because runner knee is not what this is. Can this improve your symptoms because this is also occurring in addition to the runner's knee? Potentially, yes. It doesn't hurt to try. Um, and so I would try it, go for a run. More than likely, though, it's a repetitive strain injury, the runner's knee, and the patellar tendon in this case is getting overworked and strained. So more than likely, the fib head move is not going to help. Finally, the question says, does this have to be a lacrosse ball, or can I use a different type of ball or something else? And I've been holding up sort of different balls throughout the video. I use the lacrosse ball. It's firm, it's easy, it works, but you can use, and I have used, a tennis ball, which is a little less dramatic of a feeling in the back of the knee, because the back of the knee does have a lot of sensitive structures. So you may want something a little softer. A tennis ball works. I've also used a pickleball. So this is just a wiffle ball. I tend to not like this as much because it's a little slippery, but otherwise, if you're going on skin, it should be fine. So any of these three works. Anything you can wedge in there. You can even use a rolled up towel. You just need to create a fulcrum that allows you to bend the knee and drive the fibular head forward. And then you just add a little thrust, and that will move the fibular head forward. And again, it cannot hurt you to try it. It will not make anything else worse. And if it doesn't work, it's just not the cause of your problem. So please leave me a like, comment below if this video added any value to you. And again, if you have questions about any other parts of your body in terms of rehab, training, aches and pains in your body, please send me an email at joeymatina@gmail.com, and I'll leave that in the notes below, and I will talk to you soon.